Welcome to the press briefing today. On stage, we have Dr. Albert Au, Principal and Niche Officer from the Center for Health Protection, Dr. Thomas Zhang, Honorary Consultant, Department of Health, and Dr. Larry Lee, Chief Manager from Hospital Authority. Dr. Au will say a few words first. Good afternoon, friends from the media. This briefing will give you an update of the latest situation of COVID-19 and seasonal influenza in the past week. We are very honored to have Dr. Thomas Zhang, Honorary Consultant from the Department of Health present. I'll first brief you on the situation of COVID-19 in the past week, and then I will give the floor to Dr. Lee to brief you on the situation with TMHK and also the preparation. And then Dr. Zhang will give us advice on how to prepare for the seasonal influenza in this winter. Now, this diagram is the number of confirmed cases in the past 14 weeks. In the past 2 weeks, the average daily number of cases was around 3,400 and 3,500. Now, for the past 7 days, on average, we have got 3,803 cases, and the range was between 3,286 and 4,369 as compared with the previous 7 days. It was 3,667 to 5,109 daily average, 4,142. So the past week we haven't seen a major drop in the number of daily cases. In fact, in the past 2 weeks, we are at a plateau, and the number of cases remained at around 3,000 odd cases. In the past week, the daily average number of cases locally acquired was 3,584 and 4 as against 3,953 in the previous 7 days. So it was around 3,000 odd. For imported cases, in the past 7 days, on average, we had 298 cases per day, and the range was 215 to 386 cases. As compared with the previous 7 days, from the 23rd of September to the 29th of September, it was 183. In the past week, there was an obvious increase in the number of imported cases from 183 per day to 298 per day. Imported cases account for about 8% of all confirmed cases, and about 3% of the inbound travelers tested positive at temporary sample collection center, when in late September the figure was only about 1.5%. So we have seen marked increase. As for the number of days, in the past 7 days we had a total of 47. The range was 3 to 10 days per day, and for the previous 7 days 66 were recorded. For subvariants, right now BA.5 accounts for 92.6% of the total number of cases, BA.4 2.6%, BA.2 12.10.9%. As can be seen on the chart, BA.4 and BA.5 cases, BA.5 cases was always over 90%, quite a high level. So the dominant trend on subvariant in Hong Kong is BA.5. For residential care homes, there were 19 RCHGs involving 26 residents with cases, and for RCHD, 15 cases involving residents and 1 involving staff member were reported. In the past week, schools reported 2,716 cases of students and 486 cases involving staff members. 61 classes were involved from 53 schools with some clusters. So some classes were advised to be suspended. Overseas situation, we have seen a rebound in some countries, including the UK. These three charts shows that in England, whether we are talking about cases tested positive, now there was a 21.9% increase in the past week. Number of hospitalization, a very obvious increase of 33%. Number of deaths, rise of about 8%. So it seems that come winter, COVID-19 has become active again in some of these countries. Singapore, in recent weeks, has recorded a rising trend. The figure on the left top corner is the 7 rolling number of cases in September. They had less than 2,000 cases per day, and the number of cases gradually climbed to about 4,000 per day recently, a rather obvious increase. The chart in the bottom showed us a comparison with the previous 7 days. It's close to 1.7%. So there has been a 70% increase in the number of cases compared with the previous 7 days. On the right-hand side, we see a chart indicating the number of admissions to hospitals. This has risen together with the total number of cases. The local authorities feel that the rise in hospitalizations may pressurize their healthcare system. There may also be a new subvariant, BA.2.75. Now, BA.2.75 already account for about 25% of all daily infections in Singapore. Now, we are concerned about this because it may be able to evade immunity. So previous patients with a full vaccination and previous infection may not be able to resist this subvariant. And some health authorities from overseas are concerned with relaxation of infection control measures in other parts of the world. There may be another COVID winter wave. There may be new immune-evading strains of the variant, and many countries have also relaxed control measures. For instance, in other places, people no longer required to wear face masks. All these factors can contribute to another upsurge of cases in the winter. We are concerned that in other parts of the world, influenza would be active again. In 2020 and 2021, seasonal influenza was relatively inactive in all places of the world. The blue line is the number of seasonal influenza cases. In 2021, the figures remained low. However, come this year, we could see a rising trend, and the chart on the left shows the Western Pacific region situation. There's been an increase in the number of influenza positive cases. Now we are concerned that in Southern Hemisphere during the winter, there was an upsurge of influenza activities. The left chart was the situation in Australia in 2022. It exceeded the average of the past 5 years, and it was at a recent peak. That was what happened in the last winter there.
On the right-hand side, this chart shows a rather serious situation of influenza in New Zealand. That's shown by the blue line, and the figure reached sort of a peak or a historic high. Meanwhile, we are concerned about the activities in Northern Hemisphere. In 2022, in other places, seasonal influenza in these places is more serious than before, especially US, Canada. The peak was recorded in May, and Europe as well. And for southern provinces in China, in June, there was a peak recorded in March for H3N2 strain. So there is a heightened risk for seasonal influenza infections. We have been adopting certain measures such as social distancing measures and mask wearing requirements, and seasonal influenza activity was minimal in the past. And there was a very low level of activity. It was gradually decreasing, and that accounts for lower levels of immunity. And for infants and young children below the age of 3, they may have never been exposed to influenza. And since this is a large percentage of population without exposure to influenza before, there could be higher infection levels and more serious cases. And recently, the Center for Health Protection has rolled out a number of programs, such as the government vaccination program, residential care home vaccination program, and vaccination subsidy scheme, as well as seasonal influenza vaccination school outreach. For eligible groups, we provide vaccination free of charge, and they include healthcare workers, children aged 6 months to 12 years, persons aged 50 or above, and residents of RCHEs, RCHDs, pregnant women, and other people with high-risk factors. We encourage them to get free jabs under the vaccination programs I mentioned above. And this year, we have a special arrangement. We provide COVID-19 and seasonal influenza vaccination in one go. The Center for Health Protection agrees that this is a safe approach, and the arrangement is implemented in community vaccination centers, school outreach, residential care homes for the elderly and disabled, HADH clinics, as well as private clinics. So let me appeal to members of the public. If you haven't completed the COVID-19 vaccine regime, you should do so as quickly as possible. And as the peak seasonal influenza comes, you should get jabbed for seasonal influenza as well to get the best protection. This chart shows by age group the vaccination coverage. For the overall population, the 3-dose vaccine coverage is already attaining a very high level. And for those above 80, only 71.2% had the first jab, and 29%, in other words, have never received any jab. And for children 11 or below, only 74% had the first jab. That means 26% of children haven't received the first jab. So, in conclusion, the Center for Health Protection will continue to monitor the situation of local as well as imported cases. And in relation to both cases, we will conduct a genetic analysis to detect any possible subvariants. And we will continue to keep in view the latest situation and adopt preventive action as quickly as possible. And let me appeal to members of the public again that they should get the COVID jabs and seasonal influenza jabs as quickly as possible to prevent another peak hitting us in winter. And regarding control and prevention measures, such as the red code for confirmed cases and the amber code for inbound travelers. These are effective measures in order to minimize transmission in the community. And we have taken enforcement action, and so far we haven't detected any case when our inspection teams inspected catering establishments involving those with amber code breaching the rules. As for red code holders, according to our surveillance efforts, we have detected a handful of cases involving the holders leaving their confined premises, and we have detected some 60 such cases so far, and investigation is underway. As for 3 of the cases, we have secured convictions. So we remind those red code holders to stay in the designated quarantine locations. Dr. Larry Lee. In the past week, the epidemic situation remains stable. As for the hospital admissions and the number of cases as compared with the previous week, we have not registered an apparent decrease. For hospital admissions, the figure stands at 17 to 1,800, and also new cases around 170 to 180. As for serious and critical cases, we continue to detect a downward trend. At the moment, there are 50 to 60 patients in critical and serious conditions. We expect the epidemic situation to remain stable and will continue to resume services earlier suspended. As for visiting arrangements, last week we relaxed the visiting arrangements for 26 non-essential units or departments, and starting the 13th of October, we will start phase 2, extend the relaxation of visiting arrangements to other wards as well. For lower risk groups, that is those below the age of 60 with 2 jabs administered, they could visit the patients for an hour at a time, and we would allow 3 family members to visit the patients. And for high-risk groups, those aged 60 or above and those who haven't completed the vaccine regime, we can arrange for visit twice, a 1-hour visit twice a week, but the number of visitors will be limited to 2. And we'll also explain the visiting arrangements to family members, and there would also be booking requirements. As for hospital beds, more beds will be reserved for non-COVID patients. And depending on the epidemic situation, the number of beds for COVID patients will be gradually reduced, and we are resuming services for non-essential operations and other services. For the COVID treatment center in Asia World Expo, it's now on standby. As for the North Lantau Hospital Hong Kong Infections Control Center, we have reduced the number of wards from 11 to 7. Over 80% of non-essential services in public hospitals have resumed, and they include endoscopic examinations as well as other non-essential and non-urgent surgeries. As for allied health, we have increased the number of quotas, and we have converted 1 designated COVID clinics to GOPC, and we have also resumed outpatient services in the evenings and on weekends. And we continue to keep in view the epidemic situation. We're not relaxing our efforts. And we are very concerned about a possible rebound in light of the upcoming seasonal influenza peak. And drawing on the past experience, the hospitals are getting themselves ready. And even if we are hit by both COVID and seasonal flu peak, we should be able to cope. In terms of hospital bed, we have a mobilization plan, but we will remain flexible. As we provide additional bed to cope with seasonal flu patients, we will keep in view the operation of the A&E department, the usage of beds, and will continue to enhance the collaboration among hospital clusters for effective deployment of beds. And there are measures which we feel should be enhanced. For example, there should be additional manpower for teleconsultation services, designated clinics, etc., to reduce the number of serious cases and to alleviate the pressure on public healthcare system. We'll continue to work with private hospitals. For example, patients will be triaged to private hospitals, and so that there will be a minimal impact on COVID patients.
Lastly, we'll continue to boost our outpatient clinic services to support COVID patients. We will relieve the burden of A&E department. We will have a voluntary locum scheme, and there will be special reward for these staff members. We appeal to the public to be prepared for this winter upsurge of seasonal influenza. In the past 2 years, we had seasonal influenza was inactive, and if this year we are infected with both COVID and seasonal influenza, the situation can be dire. So we should be vaccinated soon to boost our immunity. We have co-arrangement of COVID vaccine and also seasonal influenza vaccine, because usually it takes 1 or 2 weeks for antibodies to be generated. People should be vaccinated as soon as possible. And please remember all health protection measures and observe good hand hygiene. Thank you. Dr. Zhang, thank you. Friends from media. Good afternoon. I'd like to take some time to appeal to the public, mainly how the general public should cope, given that COVID and seasonal influenza may attack in the winter. There are 3 points in the main. First, as mentioned by the 2 speakers, vaccination. We have talked about COVID vaccines many times. I will focus on seasonal influenza this time. Yesterday, the Hong Kong Academy of Medicine representative came out to talk about seasonal influenza vaccination. The whole medical sector attaches importance to this. We want people to be vaccinated against SI as soon as possible. This year, we want more people to get SI vaccinated. The reason is clear, because if we have an upsurge of influenza activities, it is going to be rather serious, because we were not exposed to the virus in the past 2 years, and there may also be mutation of the virus. Many of us do not have any immunity, and we've also observed the situation in neighboring countries. And if we are infected with COVID and SI at the same time, the symptoms can be severe. So it is important that we're protected from SI. How much protection can vaccines offer? First, it can reduce the risk of infection. Secondly, for elderly persons and the chronically ill, the vaccine can effectively reduce the number of severe cases and the need for hospitalization, as observed in past years. Almost everyone is fit for an SIV. Those who are over 6 months are safe to get vaccinated. We have used such vaccines for a long time, and it can be used together with COVID vaccine. So these are the merits of SIV. We have to appeal to the public, because in the past few years, the SIV rate was not too high. The Center for Health Protection and also university surveys show that for those aged 6 months to 5 years old, only 40% of them have been vaccinated with SI, less than half. For primary students, that may be better because of outreaching teams, and the figure can reach to 60 or 70%. But for adults aged between 50 and 64, the vaccination rate is only 10%. And for those over 65, our elderly persons, the average rate is 40 to 50%. So there is room for further coverage. In particular, this year, we feel that we'll be more threatened by SI. So we need to appeal to the public to remind everyone here to get vaccinated to protect ourselves against SI. And the second appeal to the public is about the wearing of masks. Yes, we have been wearing face masks for a while. This winter in particular is not the time to say goodbye to our old friend face mask yet, because COVID-19 or SI part, there are parainfluenza and adenovirus that are also active. They can give rise to respiratory tract infections and symptoms. Now, an SIV will protect you against SI. COVID-19 vaccine will protect you against COVID. But many studies have shown that face masks can prevent a number of respiratory tract infections. For instance, a recent survey showed that in the healthcare sector, it can prevent about 90 to 8% of the infections, and the community close to 50%. In this winter, we can expect many respiratory tract viruses to be active, and so the wearing of a mask is important, and the public should be vigilant. The third point is we have to be vigilant of subvariants of COVID-19 in particular. In the past 2 years, we have seen many subvariants of COVID-19, the recent one being Omicron, but this is not the end yet. For instance, in Singapore, as said by Dr. Au, there is also a rising trend of infections by BA 2.75, accounting for about 25% of the daily infections. And in the US, there are also subvariants, and there is also XBB. Now, I will not dwell into these medical terms, but do understand that the virus is forever mutating. We will keep an eye on the trend. Now, this is not to say that a new subvariant must necessarily be more vicious than the last. It very often depends on the characteristics of the subvariant, whether it will lead to more symptoms, or whether it is immune invading, whether it is going to impact on the effectiveness of COVID-19 vaccines. So if there is a new subvariant important to Hong Kong, then we should be able to identify them as soon as possible, and we can then assess its impact on the future trend of the epidemic. There are measures for inbound travelers. For instance, they're required to do PCR tests, and genome analysis are also conducted, and that's the rationale behind these measures. So, three main appeals. First, to get vaccinated against COVID-19 and SI, and even against pneumonia. And then we should always wear our face masks. And thirdly, we should monitor the appearance of new subvariants of COVID-19. Thank you. I open the floor to the press, so please identify your media outlet and please be succinct in your questions. The gentleman in the front. I'm from RTHK. 3 questions. Now, the figures show that with the implementation of 0+3 scheme, we haven't seen a major increase in the number of infections per day. In fact, the number of deaths is also dropping. Does that mean that there is room for further relaxation of quarantine measures? And as for the vaccine pass arrangement, vaccination rate among children is not as high as expected. With the lowering of the age threshold for vaccine, have you seen an increase in vaccination rate among children? If so, to what extent? Do you think lowering the age threshold for vaccine pass is effective in boosting vaccination? Lastly, SIV, we have many recovered COVID patients. how much more likely are they to be infected with SI this year? There are suggestions in the child care sector that maybe a nasal spray form of vaccines should be made available for young infants.
Thank you. I'll take the first two questions and I'll see if Dr. Zhang has any advice on the third point. The measure that we adopt is 0+3. On arrival, an inbound traveler is required to take a PCR test. He will be issued with an amber code, and if the PCR test result on arrival is negative, then the traveler can then go about as normal, only that during the 3-day surveillance period, this inbound traveler is not allowed to go into scheduled premises or premises in which one is required to take off the mask. And we've started with a series of measures, first by 0+7 with quarantine in designated hotels, and then 3+4, and now we have the 0+3. It was implemented on the 26th of September. Today is the 7th of October. It's been 12 days only. And we've noticed that in the past week, the number of inbound travelers arriving in Hong Kong increased quite substantially. And this is within our expectation, because after all, this facilitation measure seeks to allow Hong Kong residents to return to Hong Kong or to allow other inbound travelers to come in. And it will take more time for us to observe the effect of this measure on the number of imported cases. And as mentioned just now, indeed, the number of imported cases has increased, and the number of positive cases detected at the airport also increased. At the moment, about 3% of inbound travelers tested positive at the airport. And we have not included the test results in the second, fourth, and the sixth day. So the percentage of positive results might be higher than before, and we will closely monitor the situation. We believe the existing measures are effective in controlling the risk of further transmissions in the community by the imported cases. Especially new subvariants have emerged, such as BA.2.75 in other places, or even BA.2.75.2, and according to data research, the BA.2.75.2 is even more immune evading. As for vaccine pass, we implemented the new arrangement on the 30th of September, and it's been a week only. And we've noticed that for vaccine coverage among children, as explained just now, about 20% of children have not received the first jab. And according to statistics for children between the age of 5 and 11, we have been collecting data, but I don't have statistics about the increase in vaccine coverage at the moment. The policy objective is to protect children, to make sure they have sufficient doses of vaccine to have better protection, so that they have the necessary protection when they go into high-risk premises. Dr. Zhang. I stand to be corrected, but the reporter's question seems to ask whether somebody recovering from COVID would experience a more serious seasonal influenza symptoms. Now, there is no evidence at the moment, but if somebody is infected with COVID and seasonal flu at the moment, at the same time, and according to some research in the UK, there is evidence to suggest that the death rate could go up by 2 times and the case could get more serious. There are different studies being conducted at the moment. As for nasal sprays, for application to students, both types of vaccines are recognized. For nasal sprays, perhaps additional protection can be offered on the membrane of children, but both vaccines are effective. As for the quantity, whether there are sufficient doses, I think schools will have to liaise with the suppliers. Next question. The second gentleman in the middle at the back. I'm from TVB. Dr. Au just referred to the new subvariant BA.2.75 in Singapore. My question is, for genetic sequencing work in Hong Kong on imported cases, have you identified any case involving this new subvariant? And as mentioned just now, as winter approaches, there might be another wave, together with a heightened risk of seasonal flu. How serious do you expect Hong Kong's situation to be? Will it be necessary to tighten the social distancing measures that have just been relaxed? Dr. Au, you just now mentioned that the daily caseload now stands at about 3,000, 3,500, and we are hitting a plateau. Will there be other measures introduced to further lower the daily number of infections? About Singapore's situation, in June, July this year, because of BA.5, in summer, a new wave emerged. And Hong Kong's epidemic situation was similar to Singapore's. And in Singapore, BA.5 gradually emerged as the mainstream subvariant, and as a result, the number of infections also increased. In Hong Kong, in June and July, BA.5 started to emerge in Hong Kong. And around August, early September, this subvariant also became the mainstream subvariant in circulation here. And then the number of daily cases increased gradually to some 10,000 in early September. So we're concerned following the experience in Singapore, because for the new wave of COVID in Singapore, the number of cases climbed from 2,000 to 4,000. And according to the authority, one reason has to do with the emergence of BA.5 leading to infections again, and we are closely monitoring the situation. And the CHP would also conduct analysis on imported cases. And we have identified some sporadic cases, mostly imported cases concerning BA.2.75, and we will keep in view the situation to see whether the percentage of this subvariant in Hong Kong would gradually increase, and this may impact on our assessment of the epidemic situation later. The other question relates to seasonal influenza and COVID. Basically, we are concerned that come winter, if we are struck by both COVID and seasonal influenza, there will be a greater burden on the healthcare system. Dr. Zhang, perhaps in a moment, can also supplement in terms of scientific data and risk assessment, whether he has any advice for the public. Now, regarding the overall epidemic situation, in terms of the daily number of cases, from early to late September, we did identify a downward trend. As we reached the peak on the 8th of September, when over 10,000 cases were recorded, the number gradually came down to some 4,000. But in the previous week, this downward trend seems to have stopped. We are now having a range between 3,500 to 4,500. This may be due to an apparent increase in the number of imported cases, and yet they only account for a small percentage, just 10% of all infections in Hong Kong.
Dr. Zhang, assuming that we're attacked by both COVID-19 and SI, seasonal influenza, what will be the scenario? So we have just passed the end of the 5th wave and we saw medical services affected. If we may recall what happened a few years ago when we have the seasonal influenza surge and our A&E departments were quite full. And now if the two attack us together, you can imagine the impact on the provision of healthcare services and our healthcare system. Dr. Lee made a very good point. He was aware of this possibility, so he has got plans to minimize the impact of the two viruses. However, we must not underestimate the seriousness of the two viruses. Now, in the past, a serious influenza, seasonal influenza could take 300 lives, so we must not take it lightly. So we have to rely on vaccination, protection, as well as wearing of face masks, hopefully to lower the impact on the community. Can we take an English lesson, please? The lady in the front, near the middle.
Questions from our THK. The first is for Dr. Au. You've mentioned the local COVID cases have plateaued rather than dropping further. Why do you think so? And also, have any of you encountered so-called flurona cases in Hong Kong that some people infected with influenza and also COVID-19 simultaneously? And if not, are you expecting these cases in Hong Kong? And how bad can it be? And any impact will it bring to the healthcare system? Thank you.
Thank you for your question. For the first question, when we look at the daily number of confirmed cases in Hong Kong, we see that in the past 2 weeks, there is no significant decrease in the number of cases. And so we assessed that the epidemic situation has reached a plateau level at around 3,500 cases per day to 4,500 cases per day. As from early September to late September, we see a continual decreasing trend. But however, this decreasing trend has stopped in the past 2 weeks. We need some more time to observe whether the number of cases will remain at this level or will drop further. One of the reasons for this trend might be that the general population has waning immunity because due to their previous infection, they have some immunity against the Omicron virus. But however, as time goes by, their immunity acquired from previous infection has been decreasing. So the susceptible populations will increase. That may lead to a significant number of cases remaining in the community. And second, for the second question about co-infection with influenza and COVID, in the past 2 years or 2 to 3 years, the number of influenza cases in Hong Kong remain at an extremely low level. So we do not encounter much COVID and influenza co-infection. But however, this situation might change for several reasons. First of all, in the global situation, as winter approaches, the influenza activity will increase. So this increase will bring in influenza cases into Hong Kong through travelers or Hong Kong residents going to other places. So there will be reintroduction of influenza cases in the local community. So if there is if the weather is cold or in the winter time, the influenza activity will become more active again. So this is our worry as the local immunity, the general immunity against influenza among the general populations has also decreased due to we do not encounter any influenza cases in the past 2 to 3 years. So this is one thing that we are worrying. So we encourage people to receive influenza vaccinations in order to get protected before the winter arrives.
Next, speakers off mic. Speakers not using a microphone.
As mentioned, there is scientific evidence showing that if persons co-infected with both COVID and influenza, there will be increase in the risk of death and also hospitalization or requirement ventilation support.
下一題，左手邊前排呢位啦。
The gentleman in the front, I'm from HK01. Now I've got a few questions. It was mentioned that COVID-19 and SI vaccines can be taken together, but usually COVID-19 vaccination will bring some side effects. If we take two vaccines for the same time, can our bodies cope? And secondly, should there be any time gap between the taking of the two vaccines, or you just do it on different arms and that will do? And you talked about voluntary locum scheme and also special honorarium scheme to boost our healthcare manpower. How effective are they going to be? Dr. Zhang, co-administration of the two vaccines, will that bring more side effects? In fact, this is happening quite often. Take pneumonia, pneumococcus vaccination as example. Well, you can have a jab of this on your left arm and also SIV on the right arm. So it's quite often for more than one vaccines to be co-administered. Now for COVID-19 and SIV, we have more understanding of COVID vaccines because they've been used for a couple of years. So side effects are known. They are mainly mild, like fever, mild pain, and they're expected to subside in a couple of days. We don't expect new side effects as a result of co-administration. And Hong Kong is not alone in co-administration of the two vaccines. This is also suggested by WHO. As regards manpower, the special honorarium scheme is our established arrangement, and for deployment of beds, and when the epidemic is at its peak, we will activate our special honorarium scheme. As for the locum scheme, well, again, it is a standing practice. Many locum doctors are helping our community treatment centers at AWE COVID Treatment Center and Infectious Control Center at North Dental Hospital. Some of the staff there are employed by locum arrangement, and they can help us at the community as well as our hospitals. Next, the lady on the right. I'm from Commercial Radio. With regard to the current social distancing measures and quarantine requirements, we're told that in the winter we may have a peak of COVID-19 as well as seasonal influenza. Does that mean that the social distancing measures and quarantine measures cannot be relaxed in the winter? And I'd like to know whether we have new subvariants coming to Hong Kong, such as BA 2.75. Will we see infection figures rise to a few tens of thousands as we saw in the past? And I'd like to know the number of SIV doses you have purchased for the community. Will the vaccination rate be lower, and will the upsurge come earlier than expected, according to what Hong Kong Medical Association said yesterday?
Thank you for your questions. First, in relation to anti-epidemic measures, the Center for Health Protection, Health Bureau, and the relevant government departments keep in view the situation and regularly review the measures, including the coordination and steering committee chaired by the chief executive, and there are a number of guiding principles. First of all, we do not lie flat. We would like to make a continuous effort to control the epidemic, to try to suppress the number of infections, to avoid overburdening the healthcare system and preventing needy patients from seeking help. We need to reduce the number of deaths and serious cases. And we also need to give better protection to the chronically ill and the old and frail and the young. Also, we take a science-based approach. We identified high-risk groups so as to make our control efforts more precise. We also strike a balance between epidemic risks and social activities. So be it social distancing measures and requirements for inbound travelers, we review the latest figures on the basis of the 3 guiding principles I mentioned and adjust our strategy accordingly. The government's objective is to relax measures as far as possible without compromising our efforts on controlling the epidemic, so as to make it convenient for Hong Kong people to carry out their activities. Now, at the moment, the Public Health Laboratory Service conducts analysis on imported cases, be it positive cases identified at the airport or in the community. We analyze different imported cases, including the analysis on the BA.4, 0.5, and 0.2 subvariants. And if necessary, we conduct whole genome sequencing to identify the subtype of the Omicron variant. And we also keep track of international developments. Say, if a new subvariant emerges, such as BA.2, 0.75, and if there is a notable increase in the global circulation of the subvariant, we will also keep in view the situation. We have identified some sporadic cases of BA.2, 0.75 infections, but so far we haven't identified a significant increase in local infections of this subvariant. Of course, we will continue to monitor the situation and see if this will replace BA.5. Last question, please. The speaker is not coming through. The speaker is not using a mic. On vaccination, over 1 million doses have been procured by the government for the government vaccination program and the residential care home vaccination program. And we've also procured 280,000 doses for the school vaccination outreach team. As for private clinics, I believe the private doctors have also procured the doses they need for seasonal influenza vaccination. As for, I will give the floor to Dr. Zhang. Well, I think the response is detailed enough. When we talk about when the peak, winter seasonal peak will hit us, it's really difficult to tell. From past experience, it's usually January or February, but we haven't had seasonal influenza for a few years already, and it is entirely possible that we can see a new pattern here. More importantly, we need to monitor the situation and try to identify the upward trend as quickly as possible and devise responsive plans. Last question, this lady on the left-hand side. I'm from Ming Pao. Good afternoon. First, on seasonal influenza, the government's effort is to reduce infection or reduce serious cases. Is there any assessment on the number of SI cases? Next, on the vaccination coverage for seasonal influenza, what is the target? And Dr. Lee just mentioned vaccination would help reduce admission rate and the number of serious cases. How effective would it be? And Dr. Au just now mentioned BA.2.75 cases identified by the lab. Are they all imported cases, or are there any local infections? Can you give us more details? Now, Singapore has a better vaccination coverage than Hong Kong. And after relaxing social distancing measures and arrival requirements, there's been a rebound. Apart from vaccination, does Hong Kong have any responsive plan to cope with the upsurge? And also, zero infection cannot be achieved, so what is the acceptable level to the government in terms of the daily caseload? Let me take your questions as explained by Dr. Zhang. In the past 2 years, the number of seasonal flu cases remained at a very low level. This has to do with the various measures adopted, including social distancing measures and the wearing of masks. These have been effective in curbing the spread of respiratory-related diseases from spreading. Meanwhile, for adenovirus and also seasonal flu, again, the caseload has been on the low side, and because of the low level of activities in the past 2 years, once there is an upsurge, the outbreak could be serious. But of course, that depends on the seasonal flu strain. H3N2 affects elderly people. The other strain might affect adults and children more. So it's hard to predict. But after all, seasonal flu is an endemic, and our strategy includes vaccination and personal hygiene measures to reduce infections. As for hospital admission, because of seasonal flu, on a quarterly basis, the figures differ. But in terms of serious cases, during the peak of seasonal influenza, among adults, we usually record 400 to 600 serious cases. And that in more serious seasons, there could be 300 to 400 deaths as a result of SI. So once infected, some elderly people might have more serious conditions. So as we expect an upsurge of seasonal flu cases in winter, we do have advice for the public. Let me ask Dr. Zhang to tell you more. Well, the reporter just asked whether the SIV is introduced to curb infections or to prevent serious cases. I think the mainstream view is that we want to prevent serious cases, and this is supported by many studies. For elderly patients, if they have SI jabs, the number of hospital admissions can be reduced by 70–80%. As for reducing infections, it might be more difficult, except for some particular settings. Say in a residential care home setting, clusters may be avoided. As for SI jabs, I think at most you can reduce infections by 40–50%. That's the end of the press briefing. Thank you.